thank you for going back and forth with me. So,
Yeah.
what we have found is that there's a lot of the same questions that folks want to talk about.
Hmm.
And I've offered my time a number of times to go on and have conversations with folks and schedule calls. But one, we're talking about the same thing. And two, I'm running out of spaces on the schedule to be able to do that. So, I just wanted to like touch on some of the high level conversations that I've had even this week with some affiliate owners, and then maybe just if you have anything else to add.
Yeah.
Plus, I want to make sure you get to a health integration summit too, Mister.
Yeah. Yeah.
But
I'm excited.
so it was cool this week. We had an affiliate owner, husband and wife, reach out that is very interested in coming to a health integration summit. They own a gym in Michigan. He's actually a GI doc and works like
Oh,
in the system in the hospital. And she runs the show. Runs like a healthy steps nutrition program. I think is also part of Best Hour. So like very into making sure she's running the affiliate to the best of her ability. She's very interested in like honing in on how she could integrate a number of health integrated services, right? All the things that the medical society does, and then how that would like layer in and factor into how she's going to think about business development. And
mhm.
so that was a really exciting conversation because she's thinking, I think the way we want all affiliates to think is like, how does this impact my revenue per person? How does it mesh with the things that I already have going on in my gym? And so we spent a lot of time talking about what she already has going on. And one of the questions that she asked that I think is interesting is that she's like, I don't do anything half-assed. So if I'm going into this, I'm doing this like full steam. And she's like, well, how much time is it going to take me? Right. And I think that
Mm.
that's an important thing to just highlight where it's like, okay, I'm going to start doing something new. How long or how much of my time is it going to take me, right? From a bandwidth standpoint, if you're looking at like hours per week, and then like how long will it take from a span of time where it's like, okay, now I've rolled this out and here's my new offerings or here's my new kind of, system and tiers and so on and so forth. And you have rolled versions of this out, right? So I
Yep.
want to toss it to you in a second. But, I think one of the things we come to face with is that affiliate owners do things differently, and the way that they structure and build stuff and what their bandwidth and interest and time is. And so I tried to give her to the best of my ability, like, you could spend 2 hours a week, right, reading the guide as much as you can and like thinking about how your increased education on the way you're going to talk about stuff would factor into what you could offer to your community, right? But I do
Yep.
think that the important thing is that everybody starts at a point that they're comfortable and stays in that spot until they're comfortable to go to the next spot, right? And that could
Yeah.
be a very small introduction, of whether it's just like town halls with your community, referring folks out to resources that are available through the medical society, or doing things that are a light lift so that you can feel really comfortable about what you're bringing to your folks without feeling like you have to cross into a clinician's role of talking about things that you're not ready to do yet. So
Yep.
that's
Yeah. I mean, I think you hit the nail on the head with like just getting yourself familiarized with the material first and foremost. And like you put out like a great like, I mean, I don't know, what do you refer to it as? Like it's basically like a manual on it, but it's all the
there's
information.
two. Yeah. So I think there's two things, and they're mutually separate but also connected, right? So the
Hmm.
health integration guide is tons of education, and that's more of like how you can think of yourself and how you can feel really comfortable talking about stuff that might be new or different to you. But then there's the blueprint, which is like step one, here's what you need to decide, right? Like until you decide these things, you really can't move on to decide how you're going to charge for them because you know what I mean? So it's a very step process.
Yeah. And so to me, like just familiarizing yourself with that material is going to be really important. Like I've been immersed in it because I've had the luxury of being able to build this alongside of everything that you're developing. So I do come with a lot of context that I realize sometimes I take for granted because I'm like, oh yeah, you didn't know that. And I'm like, they're like, where do you get that information? I'm like, I don't remember where I got it. Probably one of the multiple meetings we've
What
had
is
together
that?
and like the conversations. Right. And so I would first and foremost go to those resources and just start familiarizing yourself there. Like step one, first and foremost. Step two is going to be establishing trust, because that's going to be the most important thing with your members first and foremost. Because whenever you're introducing something new, it's especially something as like intimate and like medical driven as like labs, or even conversations around that, or even pointing them towards like a call with Dr. Tom, or even reaching out to your local physicians in the area that might want to kind of partner and come in and see what you're doing. Like you want to be able to talk about this intelligently within your scope. Like don't do the role of like, well, I'm not a doctor, I just play one on TV. Like don't go there, right? And so a simple step for me that was really easy, and if you have some sort of website partner, this should be like a no-brainer, is just put the Cross Medical Society on your website as a partner. Because then for me it was super easy, because a lot of people kind of go to our website. All the new people that might be checking out your website like lead wise will see it up. We have it right across the top bar where we have like the program schedule, gym info, CrossFit Medical Society. So then as you're talking about it, you could just point your members like, hey guys, if you haven't been to the website, we're going to be working with the Cross Medical Society. I'm super excited to start introducing some cool stuff to you guys. And that's it. Just tease it a little bit, right? Very simple first start. And then you're building that association, which helps with the trust.
Yep.
The second thing that I did was we're finding out like, okay, who might be interested in potentially getting some lab work done. And that just starts internally with our members there, reaching out. And what I did for just an easy control, and it helped sell it a little bit. And I know the S word is scary for some of you guys because I don't want to be your salesman. But what we did is we just said like, hey, we're taking on 5 people to help us test this program.
Mhm.
And what that does there is it gives you some leeway in terms of like you don't have to have it all figured out. And as you're working your way through this, meaning like, okay, they paid for the labs, you got to get the rec, you're like, wait a minute, I got to kind of reach out to the medical side and make sure I'm inputting it the right way or whatever the case may be. You get a lot of leeway there. So reach out internally, whether that's via email, whether that's just you handpicking a few people too that you have a great relationship
Yep.
with in your gym. Ask them if they're interested in getting some blood work done. And then just get your cost all sorted out. Like you'll be able to go into the Cross Medical Society, you'll be able to see the cost of the labs there. And then I reached out to the local local phlebotomist. With your
Yep.
help, Jen, you were able to find that company for me. It was super easy. And then we got a price per draw.
Yep.
And then we're like, okay, cool. Now we just add the price per draw plus the rec, plus we put about a 30% margin on that, and
Yep.
just as a pass through.
Yep.
So like those are your first steps. Establish yourself with the material, find some way to associate yourself with it, with Cross Medical Society, to introduce it to your members, and then find 3 to 5 people that are willing to kind of go through the program and let them know that it is a test pilot. And that will help you work out all the kinks. I would say if you dedicated 3 hours a week to that, you could pull that off within the first month, from the time of first familiarizing yourself with the material to getting some association on your website, potentially with that partnership with CrossFit Medical Society, or just throwing it out to an email to your members if you don't want to necessarily put on your site right away, and then getting yourself your first test pilot group to run them through a lab.
Yep.
As far as the pricing goes, like that's up to you guys. Like once you have your cost of goods, so to speak, the cost of the lab plus the cost of bringing out a phlebotomist, if you're in an area where that's not possible, or that just seems like too much work, they could also go to LabCorp or one of the places. I suggest you do spend some effort getting the phlebotomist. That was a huge like differentiator for us, because people know trying to get their labs and going through that does take a lot of like time and energy. And if you're able to be like, nope, you just come right here in the gym, they get it set up, you book your slot, and you're good to go. That was like a really big selling point of convenience for a lot of our members.